most famous physical therapist on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you the one critical exercise that you should be performing after knee replacement.
That's right, Bob.
And we've seen a lot of them. Thousands.
Thousands,
Yeah,
yes.
Between the two of us, we're probably 10,000s of 100,000.
We're not that old, are we?
We're old. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, you want to go to our website, bobandbrad.com, because we're always giving something away. Show you in just a minute what it is. But you can also find it on Facebook. It's pinned to the top of the page, our giveaway.
The top, yes.
The top, yep. And if you go to Twitter or Instagram, we have a 60-second version of our program.
That's right.
So the thing that we're giving away this week is the Bob and Brad hanging handles.
That's right.
These handles allow you to be attached to our wall anchor, which you get along with the kit. And along with that, you get a set, one for each arm. And this allows you to work on hanging, which is great for shoulder pain.
Oh, yes.
Which there's been a whole book written on it by Dr. Kirsch.
That's right.
And it's also great for back pain and decompression of the spine.
I'm feeling good, Bob.
And posture.
But we better get on with the knee.
Let's go to work. Okay, so right after a knee replacement, Brad and I are concerned about 5 main things.
As well as any other therapist.
Right. 1, we're concerned about watching for blood clots. Blood
Right.
clots can be very dangerous. 2, we're watching for infection. 3, we're watching for edema or swelling.
Right.
We're trying to control that. Number 4, range of motion and stretching. We're concerned that we got to get it moving.
Right. That's what therapists are known for.
And number 5, strengthening.
Another key aspect.
Now, what's nice about this one exercise, it's going to take care of 4 of those. It's not going to take care of infections, but it's going to help you with the 4. The big thing about, I want you to think about after you have a knee replacement. Scar tissue is being laid down. And I had one surgeon said, Brad, that it's a race against scar tissue.
Sure.
Because as the scar tissue gets down, the knee's not going to move as well. So you want to get it moving as soon as possible and as far as possible so that you can regain that motion and function.
Right. And it's less painful that way. It just makes everything faster. So we want something to help promote that and make that easier.
So what we have found, this is another one of our creations. We have found that the best way to do this is with one of our knee glides. Now, the reason the knee glide works really well is because you can start with it in bed.
Right.
And this is something that there's really no other substitute for it.
Right. You know, they have that.
Passive motion machine.
Right. But they're very expensive. A lot of surgeons don't use them anymore, at least the ones that we've been working with, because it's passive.
Right.
This allows range of motion, and it starts some of the strengthening at a very early phase.
So, Brad, why don't you go ahead and demonstrate?
Yeah, that's right. So we're going to pretend this is, day 1 right after surgery, maybe the next day.
So what we did, this is the knee glide. It's a simple device that slides like this, but it also, you could use a towel when you're in bed because it's a little bit harder on your heel.
Right, because you're not going to have a pair of shoes on.
Right.
So that makes it comfortable. And the resistance is very low on this, so you can get this knee movement. Yeah, give me a pillow, Bob. Because now, in a hospital bed, you may be elevated slightly, but you don't want to go too high up. But we're just going to slide. Now, early on, you may have the therapist or nurse, or you could help with the other leg possibly.
You could even take a sheet.
Sure.
And pull. I'll grab one, Brad, while you're talking.
You could even use your gait belt that they're going to walk with you in the hospital. Whatever. The therapists are going to help you out, the nurses. But this option, really can get that knee bending. And I'm doing some active motion here. It's not like a machine is doing it, but we have some active, and you feel more under control.
Right.
When that machine is moving your knee.
It can move it beyond what you want to move it.
And it can be uncomfortable and painful.
Even for the scar,
as a matter of fact,
site.
Paul, our patent lawyer who helped us patent this, he had his knees done. He said he hated that thing. It was so painful. He said this is going to be a perfect, from his personal experience. But anyways, and that works really nice that way. And if you do want some motion laterally.
Well, first, Brad, do you want to show extension?
Oh, sure.
Yeah,
Yeah.
so when you get to the end right here, your knee's probably not going to go this straight.
Right.
It's going to probably be like right here. So with the towel kind of rolled up like this, you can actually work on extension, let gravity do it, or even take your hand and push just slightly to.
And with that, you know, you elevate the bed up so
Right,
you're up here
exactly.
comfortably, and then you can use all these independently. And the more independent you are with your exercises, the better the results
Now,
are going to
it may
be.
be too much to push on it at the start. You may want to just let gravity do its thing, but gravity will be working on it when you have the towel rolled up like that. So yeah, you were going to show hip abduction too, Brad?
Yeah, you know, it just gives another aspect so you can work some muscles that should be worked while you're in bed.
Sure, keeping the toe straight up.
Yep.
Don't be turning it one way or the other.
Right, this way or that way. Just another really cute way to work it. Okay,
cute,
Bob.
Really cute?
Cute. Well,
okay.
You know.
Well, let's say now as we progress, you're going to start using the knee glide on the floor. Now, what's nice about the knee glide on the floor, because people used to just put a washcloth down.
Right.
It's not as comfortable on the leg right when you get to this point. You see how dorsiflex or plantarflex the ankle is?
Right.
That's a term for saying it's pushed down.
Right.
You put the little handle up like this, and now it's comfortable to work on. And plus, the gravity's helping you work on
You got a little
flexion.
bit of downhill. So it works really well for the range of motion of the knee. Now, what I do with patients is I'll have it flat a lot of the times, but I'll say, when you get to here and it starts to bend your knee and you want to get a little extra stretch, either I will help push or the patient themselves can just take your good leg, go over the top, and you're going to push back, stretch.
And if it gets too far, if you go this far and you can't really go around the ankle anymore, then you go to the front of the knee glide.
Precisely, Bob. And when people get really good and they're past, you know, up to 110 or so degrees and we want to work more strengthening of the hamstring, you simply turn it around and you work uphill this way. And this actually is amazing how much hamstring you get. I mean, if I do this with a healthy leg like mine and I do this for a few minutes, I can clearly feel my hamstring start to fatigue. Yep.
So what I recommend, Brad, with both of these, you know, hamstring, quad, or whatever, I always say do 10 of them. Do 10 just going back and forth, and then on the 10th one,
there you go.
I go ahead and give it a little stretch.
So every time you're not pushing on it. Motion, stretch.
And then if you want to add some weights as you progress along, you can go ahead and add some weight onto your ankle, and it'll make it a little more difficult, and you'll start getting some more strengthening for the leg here.
You know, this is the kind of thing, because at least in the States, United States, they want people out of the hospital as soon as possible. Right. This gives you an opportunity to continue your exercises at home really effectively.
I always think it's a great visual reminder, too. If you walk by and you see the knee glide sitting there, it's calling out to you, Brad. It's saying, it's time to use me. It's time to put the time in.
Say no more.
We recommend using it 3 to 5 times a day.
Yep.
And up to, like, I usually say 3 to 5 minutes.
Yes.
Usually when they start, probably about 3 minutes, but later on they can go up to 5.
Right.
So,
all right.
And then also at that point, you know, you can work on extension by just putting your foot up on another stool or chair.
Well, actually, some of our therapists
I know some of our therapists do this.
We'll go out like this, and it allows your foot to slide, and you can get that straightness of the full extension aspect. You know, that's an important part of walking, to get full extension. So it covers all the bases, Bob.
All right. Remember, Brad and I can fix just about anything
except for
a broken heart.
And I don't think this is going to help.
No, but we're working on it.
Yeah.
So
we'll figure out something for that.
Thanks for watching.